Hello, I'm Dr. Jay Levy, and I'm co-chair along with Jane Borchik of the Advisory Committee to the Senior Health Initiative here at Capitol Lakes. The committee is comprised of a number of the residents of diverse backgrounds who advise and critique the project as it develops. For today, it's my pleasure to introduce Mia Morrisette, who is a social worker who paired her clinical and leadership experience with an MBA in ethics and leadership from Viterbo University in La Crosse, Wisconsin. Morrisette is the Advanced Care Planning Coordinator at UW Health, an integrated health system of the University of Wisconsin-Madison. She advocates for nothing short of a cultural shift where discussion about quality of life and death are part of acceptable everyday conversations from the kitchen table to the doctor's office. Today it is my pleasure to introduce Mia Morrisette.
Thank you for the introduction. I'm really honored to be here tonight to talk about being a healthcare agent and conversations that matter. I'm going to share some tips and resources on this topic of being a healthcare agent for a loved one and how to better be prepared for your role. You are a healthcare agent if your loved one has appointed you as their power of attorney for healthcare on their legal document. So these are the topics that we're going to be discussing. Why is this important? The power of attorney for healthcare document, a few tidbits about that, your roles and responsibilities of being a healthcare agent, and how to start and continue the conversation, which is really vital to being a healthcare agent. So the question that people ask when I do this presentation, why is this topic important? Why should I be concerned about advanced care planning and being a healthcare agent? Well, we like to use a little humor from The Onion, which some of you may know. The news flash from The Onion is the world death rate is holding steady at 100%. Out of Geneva, Switzerland, the World Health Organization officials expressed disappointment Monday at the group's finding that despite enormous efforts of doctors, rescue workers, and other medical professionals worldwide, the global death rate does remain constant at 100%. So we like to laugh about this, but let's talk about the reasons why this conversation is really important. Understanding the care preferences of your loved one will help you better reflect their wishes when the time comes and when the need arises. It helps in informing the healthcare team of important healthcare preferences, and you will experience less guesswork and more clarity in your role as a healthcare agent. People tell me all the time when they are doing their healthcare powers of attorney, I'm doing this because I don't want to be a burden to my family. So taking that the next step, communicating your wishes about your healthcare in the future will help alleviate the problem of potentially having a burdensome situation arise. So I feel it's important to take a real life situation just to highlight this topic. So this is a story of a husband and wife that came to see me at the clinic I worked at in Madison last year. So they're a married couple. They were referred by their primary care doctor. They were 67 and 68 years old. The husband was in good health, but his wife was in declining health. And we sat and talked about the topic of quality of life, which we'll discuss a little more. But I asked both of them, what does quality of life mean to you? And the wife was talking about, I love babysitting my little grandson and volunteering at church and going out for dinner. I love camping and concerts and road trips to Ho Chunk. But I haven't been able to do so much of that lately. I haven't been feeling well and hoping that things get better. So we had this really robust, rich conversation, husband and wife exchanging their thoughts on the topic of quality of life and end-of-life care. We completed the power of attorney for healthcare document. A few months later, the husband found his wife unresponsive at home. She was taken to the emergency room at UW Hospital, put on a ventilator, and placed in the neuro ICU at UW Health, where it looked like her condition is grave and she would have little hope of return to a meaningful quality of life for her. The ventilator withdrawal was scheduled, and she actually died before that occurred. So I had the opportunity to call her husband and talk with him, and he said, it was so meaningful that we sat together in your office and talked about these what ifs. I never thought that what if would come, but it did. And having that conversation made my decision maker and job as a healthcare agent much easier. So let's transition away from kind of this story and highlight some of the steps that go into this. So the legal document where a person chooses a decision maker to carry out their healthcare decisions in the future is called the power of attorney for healthcare. Most people have what is called a statutory document. It basically is just the legal aspects of the power of attorney for healthcare. A person checks 3 boxes required by the state of Wisconsin. They list 2 healthcare agents. They sign the document, it's witnessed, it's done. But it's missing a key component, and that is, as you can see from the slide, the values part. What are the person's values around end-of-life care? What type of care would they want in a grave condition with little hope of recovery? So many people think they have this task done, it's checked off on their list, though a very key part is missing that would be useful to the healthcare agent and the healthcare team, and that's a discussion. So I urge people to find their power of attorney for healthcare document, dust it off, and share it with your healthcare agent so you can become familiar with what's in the document. So let's talk a little about the responsibilities of being a healthcare agent. You can make choices about medical care, review and release medical records, arrange for care and treatment, and make decisions on living situation, decide which healthcare providers can provide treatment, and also carry out the foundational wishes of your loved one about their healthcare preferences that they have. So a lot of people think of, I'm a healthcare agent, I'm going to rush in when the phone call comes to the hospital and help make decisions. Actually, when you accept the healthcare agent role, it may be something that you do for even a decade or more. In the case of your loved one perhaps having dementia or Alzheimer's, it's a long-term commitment to the care of the older adult that you're assisting, looking after. So if you have the legal document done and it's signed and witnessed and it's in the right place, the key element that's missing is one-on-one conversations. So I have a list of these conversation starters to get you going, and there's nothing to do but go ahead and start the conversation. And I heard a physician say recently, you can't have a good discussion about the end of life at the end of life. That's too late. So here are some great conversation starters that you may have with your parent, your spouse, the person you're acting as a healthcare agent for. What does living well or quality of life mean to you? When you think about the last phase of your life, what is most important to you? How would you like this phase to be? What are the particular concerns about your health in your last phase of life? Let's make a list so we can talk to your doctor. When would it be good to shift the focus of care from curative to quality of life and comfort? And what would a good death look like for you? Now, some people may not think that this is good kitchen table conversation, but I beg to differ. These are conversations that are very, very rich for family members and loved ones to have. And people come back after I meet with them and help facilitate these conversations with such great thanks. It opens the door for these conversations to continue in the future. And the answers are very surprising. And people say it makes us closer as a family having these discussions. So I encourage you not to be shy and engage in these conversations. Let's return to talking about the power of attorney for healthcare. A lot of people think, I saw my attorney or I got this done at the hospital. I don't ever have to look at it again. That's actually really incorrect. We encourage that you revisit your healthcare power of attorney if you're in good health every decade. So I'm in good health, but I seem to dust mine off and make changes every few years. If you have a death of your healthcare agent in the event of spouses who are the same age, or a dispute with one of your healthcare agents, it's time to look at your document again and perhaps revise it. If you become divorced from your spouse that's listed as your healthcare agent, the document is legally invalid and needs to be redone. If you have a diagnosis that is a game changer for you, revisiting these topics is crucial, or if you have a decline in your condition. So the idea is this document's not a once and done. It's meant to be revised as your circumstances in life change. So here's the question. Where is the power of attorney for healthcare? Patients end up in the hospital, and that's the million-dollar question. I know I did it. I think my son has it. It could be in my lockbox. Knowing where your document is and making sure appropriate people have the copies. Each of your healthcare agents need a copy. Your healthcare system, if you file it with your primary care clinic, it'll get into the electronic medical records of your health system. And then again, revisiting the conversation when need be, and keep the original of your document where it can be easily found. So people often think, I've done this document, I've appointed my healthcare agents. When does the healthcare agent's authority begin? It doesn't begin until your health condition is such that two physicians or a physician and a psychologist personally assess your condition and would deem you to be incapacitated. And they sign a statement that gets filed in your record, and then is the time for your healthcare agents to begin making healthcare decisions in your behalf. So it's important for people to know where the legal responsibility begins and where it ends. A person may have a very rough road with their health that causes them to be so sick they can't make daily decisions about their health care, but when they improve, then they can have their capacity status regained by one physician and continue making their own healthcare decisions. So I have included a couple helpful resources for you to look at that are good conversation pieces as you prepare to talk with family members, loved ones, good friends about this topic of advanced care planning. GoWish.org, theconversationproject.org has excellent starter kits, and I've used some of the material from there, and also the book Being Mortal by Dr. Atul Gawande. I have listed contact information for UW Health if you have questions about your power of attorney for healthcare or being a healthcare agent. But if you use another health system, feel free to call them and ask them for the resources that they may have around advanced care planning. I hope this information was useful to you, and I appreciate the opportunity of being able to present.